their working hours often extended to 11 hours per day, and they were doing all this sort of physical, manual work, time and again, lifting patients, transferring them to the, to the toilet, or to handling them the bedpan, or even turning their position. So all this did have impacted their back and the wrist and the neck. So they were experiencing severe musculoskeletal disorders, and this could actually lead to even a loss of their job, because if they cannot continue in this profession, they would have to be, they would lose a job. So it would work involve carrying at least 12 patients per day for about 30 steps, like maybe from the operation theatre to the room, or from the toilet to the bed. So wherever this was the most significant high-risk factor for the onset of MSDs. It could affect, as I said, it could affect any one of us, even doing simple tasks at home. If you don't take care of a posture, it could affect us. So imagine these nurses who are doing this day in and day out, handling patients. So this was the most high-risk task that they were seeing. And again, this was, they were shown the basic areas where, and it was seen that the lower back was the most affected area where they experienced severe pain. And they also had other ailments like, hypertension, some of them had blood pressure, diabetes and so on. Along with that, this was a physical discomfort. They also had severe cramps in the legs, the wrist, forearm, all these areas experienced severe pain. Yeah, next. So that was this pain in the lower back, wrist, lower leg. What did it do? It interfered with the ability to work. And that's where we find fault with the nurses at times. We also lose our patients and we get angry when they're doing it rightly, or they're not handling our patient properly. So it's easy for us, to find fault, but we actually probably, that nurse is suffering from some sort of a discomfort which we are not aware of. The hospital authorities are not really looking into these aspects, and therefore it's high time, very important, that the authorities do look into what could ail, what could be the problem with our nursing profession. Yeah. So these were the most stressful: transferring patients, bed to stretcher, even making an occupied bed. If you have seen one, you'll definitely understand what I'm saying, or inserting a bedpan, etc. It is not an easy task at all. So the conclusions were that the nurses were found to be a high-risk group with highest exposure to occupational hazards. Pain in the lower back, wrist, right and left, lower leg were reported to be very high, so it was highly significant. The high prevalence in the low back, wrist interfered substantially with their ability to serve patients. So next time, God forbid, anybody is in the hospital or you happen to see somebody and you find that the nurse is not able to, at least we could just ask them, which problem hai kya? I mean, are you suffering or something like that? So I don't know how far the hospital authorities are going to look. It's high time that they take care, because in most of the globally across, they have now taken steps to overcome these sort of difficulties with more mechanical devices. Whereas here in India, when I say here, in India, we don't have the mechanical devices as yet, even in the private settings. So we could have, these are the different effective interventions. You could have handling equipment or storage areas, work-oriented policies. You could have patient care, ergonomic courses, no lift policy, train patient handling. You can train them, give them a training, or give them better equipment to transfer patients and so on, so that their health is also protected. This is a possible way forward, and we really hope it is looked into. We are sharing this with the higher authorities, with the medical organizations. Good ergonomics, which should be a part of the nursing curriculum, regular refresher courses, hospitals should be well equipped with all the necessary lifting equipment, and that should be in a working condition and stored. What happens is hospitals buy a lot of equipment which is never used. It is put into a locker and never used, and then of course it gets spoiled and it's gone. So just the money is spent, but nothing is done about it. So it's high time that this needs to be looked into, and have design interventions to be planned to reduce the occurrence of such kind of situations, and similar studies could be conducted in all Indian towns and cities, and now I'm looking at a possibility of if you could even take this further and have something like this in Nepal as well, study the nursing profession here and how they are being supported by the government. So this is my brief presentation. I thank you all. Thank you very much. In Bharat, Nepal, Chairman Sir, for giving me this opportunity, and thank you once again.
Now we will